There was a recent study in the BMJ that took a look at similar income countries to determine who had the best life expectancy, the best overall longevity when you equate for socio-demographic factors. Now, what this study did in BMJ is it took a look at 6 countries with very similar sort of socio-demographic pieces when you factor them all together. It looked at the US, it looked at Canada, it looked at New Zealand, it looked at Australia, it looked at Ireland, and it looked at the UK. Okay, now when they looked at these, they factored in for inequalities throughout the different socioeconomic groups. What this means is they were really able to look hard at the data and see who has the best life expectancy. And the main thing that they looked at is the life expectancy at age 65, meaning when someone reaches the age of 65, how much longer on average will they live? What is their life expectancy after 65? Here's what they found out with this. They found that Australia had the highest life expectancy after the age of 65. Okay, so on average for men, it was between 1 and 5 additional years above the US, and for women, it was between 1 and 4 additional years, meaning that's a lot. So someone is able to live an additional up to 5 years just because they live in Australia, even though, believe it or not, the food is kind of similar. And there's other things that we can factor in here, which we're going to talk about in this video. So let's break it down. So after today's video, I put a link down below for 25% off Seed's Daily Synbiotic. I'm a huge fan. It's the only probiotic that I personally use. And the interesting thing is they publish a lot of their own literature. So they publish their own clinical trials. And sometimes it doesn't work in their favor, but they publish it anyway because they are honest. And that's what I appreciate about them. But interestingly enough, it's the only probiotic that has this multi-stage delivery system where it has a capsule inside of a capsule. So when you think about probiotics, it's easy to think supplement company sham. But the reality is there is not a whole lot more in the world of supplements that is more vetted out than probiotic usage. The problem is most are destroyed in the gut. So that's what I like about Seed is they put their money where their mouth is with their technology, with their clinical trials, and also just with overall customer service and quality products. So that link is down below for 25% off Seed's Daily Synbiotic. So when you look at Australia leading the way, we have to ask ourselves, like, what is it about Australia? Because the interesting thing is that their obesity rates are actually quite high, yet their longevity is quite good. And this study factored in inequalities throughout the region, which means it wasn't just looking at the outliers, it was looking at, okay, even if we factor in for different socioeconomic, sociodemographic factors within a country, who still comes out on top? Well, they found that Australia, in this case, had less within country inequalities, meaning the life expectancy was similar for someone in a poorer bracket from a richer bracket. Like the life expectancy didn't really skew that much, which means that all people have access to good food and potentially good health care. Additionally, there was less drug and alcohol related deaths, which is interesting. That says something about perhaps policy, perhaps just lifestyle. If people are healthier and active, maybe they don't turn to those things as much. There was more screenable cancer. So basically they were able to detect things earlier on, which is extremely interesting. And there were less risks of respiratory illnesses, which again can just speak to the general health of a population as well. Because when you look at things like hospital-acquired pneumonia, things like that, the more hospitalizations, the more, all that gets factored in. Where things get kind of interesting though, if you look at stuff from a regional perspective, Australia and New Zealand are very close to each other. Yet Australia did better than New Zealand, especially when it came down to like cardiovascular disease. So kind of interesting. It makes you ask the questions, well, are they eating similar foods? And yeah, they kind of are. But then we look at immigration, which sounds interesting because who immigrates to New Zealand is actually somewhat different than who immigrates to Australia. New Zealand gets a lot more islanders and a lot of other regions, which may actually bring with them a higher risk of cardiovascular disease to begin with, whereas Australia has more Europeans and even Northern Europeans coming to it. Which brings another situation to mind, which I know we're getting into interesting stuff here that's not necessarily diet, but it's very important and it matters. Australia led the way with the best life expectancy, but also had the highest amount of foreign-born immigrants. So 30% of the population were foreign-born. And we know from other literature that typically people that are born in foreign countries that come to the United States tend to live longer. In the case of the US, it's probably because they're bringing with them better cultures and better habits in terms of food, in terms of exercise, and just moving around, compared to what happens if you're born and raised in the United States and you just develop the American way of life. Well, it's probably similar with Australia, because interestingly enough, Australia has a pretty high obesity rate, and amongst these groups of countries that were analyzed, it had the second highest obesity rate, obviously US being the first, yet the best life expectancy. The big glaring factor, independent of more foreign-born immigrants, was that there was less smoking. So Australia seems to have pretty low amounts of people that smoke and low amounts of people that drink compared to a lot of other cultures. People still drink, for sure. This matters. There was a study that was published in The Lancet that took a look at 204 countries. So this study determined that there's about 7.6 million smoking-related deaths and about 200 million adjusted life years related with smoking, meaning smoking has impacted 200 million plus years of life by either shortening life or affecting life through disability, you name it. Okay, we don't need to go down the rabbit hole of smoking is bad. We pretty much know that. Asterisk, maybe the nicotine stuff is a separate equation, but the smoking itself is bad. But the question that we're all wondering is, what is their diet like? Because Australia and the United States, they are very different with their diet, but at the same time, there's still a lot of processed stuff, still major industrialized. Okay, you have a lot of that. You have very similar kind of processed foods. Ingredients are a little bit different. The US definitely allows a lot more in the way of, I'm just gonna call them questionable ingredients that come in compared to Australia. But I think the biggest thing is just even the language that is used in sort of the food guidelines. So the Dietetics Association of Australia has some interesting guidelines. For example, when it comes down to foods that should be limited, unlike the US, Australia actually names specific foods, not brands, but foods. In the United States, we might say limit sweets or savory things. Very vague language that almost invites people to still go eat whatever they want. Whereas in Australia, it actually names things like pastries, things like cakes, things like chocolates and candy. It specifically itemizes them much more than the United States does, which may sound like a small thing, but when you're talking to people that don't know a lot about nutrition and they're just trying to navigate life, having things spelled out for you, that specificity makes a dramatic flipping difference. A huge difference. And it also shows that they're not afraid to call things out that could be nefarious. Now, additionally with this, processed foods and especially like low quality processed meats are considered much more discretionary. Whereas what I find interesting in the United States, as someone that's lived here almost all my life, with the exception of when I lived in Europe, we almost say that if we tell people to limit a cake, if we tell someone, hey, don't eat so much cake, it almost comes across as like you're doing something wrong, like you're taking away a freedom for them or you're demonizing something when you're just being more specific about what they should possibly limit. Whereas that specificity in Australia can actually trickle down into the choices that people make. But I don't want to get ahead of myself because Australia still had a high obesity rate. It was only in second place and the US was in first. I think the big factor comes down to healthcare. And if you're still with me in this video, you're gonna hear me talk about things in a way that you probably haven't heard me talk about things, because usually I'm talking about food and nutrition and dietetics. But I do wanna focus on how their healthcare system is different without getting on my high horse too much. FYI, I did work in the healthcare industry for a very long time on the administrative side. So I understand the inner workings, I understand the reimbursement process, I understand how that works, and it's scary. So there was a 2021 study that looked at the Commonwealth Fund report, and it looked at the 11 most high-income countries. It looked at 71 different parameters, and it was really analyzing 5 important aspects of healthcare. It was analyzing access to healthcare. It was analyzing the administrative efficiency. It was analyzing the equity, like how equal it could be for different people. It was looking at the overall process, like how streamlined was this process? Did it work? Another part of the efficiency, and the overall healthcare outcome. Like, what was the result? Like, not just did they live longer or were they healthier, but like, did it break the bank for these people? These big, wide varieties of things to look at encompassed in these 5 outcomes. So in this particular case, Norway took the cake. Norway had the best healthcare overall looking at these parameters. Next up was the Netherlands, but close behind in third place was Australia. Australia has really darn good healthcare. The US ranked dead last in this group. Dead last. They were last on access, poor healthcare access, last on efficiency. Anyone that's ever gone through the system knows how inefficient it is. Last on equity, and definitely last on outcome. And the United States spends the most out of all these countries of their GDP on healthcare. Yet we have the worst outcome, the worst efficiency, the worst. How does a country that understands business so much screw this one up so badly? And I don't want to make this just about the US. The bottom line, what we're focusing on here is Australia had better access to healthcare and better outcome. At the end of the day, like early screening, being able to get in, that stuff makes a big dent. Even considering their obesity rates were pretty darn high. This is a big deal, and I'm not sitting here beating my drum trying to change the world with this. But I think it's important that we maybe let go a little bit of some of our lifestyle grip that we have. We need to change this, we need to change that. We need to realize that this system is somewhat broken. And that makes it really hard, and it puts us at a disadvantage. So what it does do is it enlightens us to know that we do need to educate ourselves, because preventative care is in our hands. That's just what it comes down to. And I'm going to read you a quote from this study, just line for line. 4 features that distinguish top performing countries from the United States. 1, they provide for universal coverage and remove cost barriers. 2, they invest in primary care systems to ensure that high-value services are equally available in all communities. 3, they reduce administrative burdens that divert time, efforts, and spending from health improvement efforts. That's a big one. Number 4, they invest in social services, especially for children and working adults. I think number 3 is something that just makes so much sense. Why are we diverting attention away from the outcome? Always work closest to the outcome. A to Z, what's the desired result? Why are we getting lost in the minutia? As always, keep it locked in here on my channel. I'll see you tomorrow.